Hey, welcome back to my channel. So what I'm showing you is what I brought for lunch, which is some new tea that I purchased at Publix, as well as some fruit. But it's important to bring a healthy lunch.
Hey, welcome back to my channel. Just to let you know, I'm on a lunch break and I thought, why not record a quick video on what it's like being a case manager and provide some tips as well as some pros and cons when it comes to case management. My lunch break is almost over, so don't worry, this video won't be too long. All right, as you can see, as far as the intro in this video, I did include some clips of what I eat for lunch. And the reason I included that is because it's extremely important to at least have some type of healthy snack when it comes to this kind of job. You're sitting at your desk for long periods of time, making sure that you're keeping up with your documentation and all of that. So I thought, why not include that? Because that'll be a great tip, right? You want to make sure that you're still taking care of yourself while you're taking care of others. Another tip would be organization. If you see me looking down, it's to make sure that I don't miss any tips or anything. You need organization. You don't know how much of a caseload that you're going to have when starting out. Me, I've only been in this particular field for a few months, but I thought while I'm learning, I could teach somebody else out there or help them or answer any questions. Organization is a big plus because you have to make sure that you're keeping up with your patient's files. Even if a majority of your work is done on the computer, it's good to know and remember who your patients are and make sure that you're staying on top of it. So the next is going to be communication. You're doing a lot of communication throughout the day. Depending on where you're working, you're going to have to report to providers, keep them updated as far as what's going on with the patients, what they reported to you. And you have to make sure that you keep open communication with your patients as well to make sure that you're available, to ensure that you are able to help them with whatever needs that they may have. So you're communicating with a lot of medical professionals, patients, as well as possibly the families of patients. So it's important to work on those communication skills. And you can always enhance them if you need. Go on YouTube. We social media is huge. So I know that YouTube is possibly one of the tools that you're going to utilize if you want to improve how to communicate when it comes to patients, medical providers, or whoever it may be. Next, it's best to be empathetic when it comes to your patients and understanding what they're going through. Even though it's not you personally going through it, try putting yourself in that person's shoes so you can have proper understanding of how they're feeling. So, empathy is a big plus. Okay, so another tip I have is cultural competency. And what does that mean? We are in the US. Well, I'm unsure exactly where you're at, but I'm in the US. And it's best to know who your population is mostly where you're at, where you're currently working, right? So if you're working with Latinos or Latinas, I hope I'm saying that correctly, it's best to know a little bit about their culture. If you're working with Haitians, it's best to kind of be a little bit knowledgeable of what's going on. If you're working with a lot of people who are in the LGBTQ community, it's best to educate yourself so that way you're aware of what's going on and you could really like provide more if I'm making sense. If not, go ahead and let me know. All right, so one of the cons, one would possibly look at it as a con, somebody might not, but I don't get to walk around as much as I would like to, and I really like moving around. So when you're not moving around and you're eating more than moving around, right, you're gonna put on some weight. So when you're trying to be healthier, that might be looked at as a con because hey, you're eating, when they have that good food around. Now you can choose to say no, but it's hard to say no to free food, right? So I have to be a little bit more conscious of what I eat. So if you are thinking about coming in this field, be conscious of what you eat and ensuring that you move around a lot more so that you can keep that heart rate going. You get what I'm saying? So to me, that's one of the cons. Another con is a lot of the times the workload can be a bit much. So me, I like to be extremely proficient and have a good turnaround time when it comes to request or whatever the patient would want. So to me, that's somewhat a con because you want to do a good job, right? But because it's so much, you have to kind of space everything out. So that's another con. A pro is being able to help patients. That's the best part. Feeling like you're giving back, feeling like you're helping that person that's going through a tough time. So, if you're an empathetic person, you love being around people, you like helping, this is the best field for you. I absolutely love helping people. I love making a difference, if that makes sense. If I can assist somebody, why not? And I get to work with great people, then that's the best thing. Okay, so another pro would be based on where you work at and the demand as well as the company, the pay is not bad at all. It depends on your situation as well, what you may feel is a good salary and possibly what's not a good salary. But like I said, location matters and your personal situation, but the pay could be good. There have been some salaries where I've seen where it's like, no, this ain't paying enough, this ain't it. And you have to make sure that you are at a company where the salary is going to be able to take care of your bills and then some. I know this was a quick video, but that's the end of my video. I have to go back and get to work. But if you have any questions for me, feel free to drop them in the comment section. I personally feel like this is a great field to be in. My background is in public health, so I'm exactly where I want to be. Don't forget to check out LinkedIn. Just do some quick research as far as what companies out there are looking for case managers. Make sure you are checking out the salaries, checking out reviews. It's very important. So if you have any questions, feel free to drop them below. And don't forget to like, comment, share, and subscribe. And baby, I got to get back to work.